So at this year's ASCO, we are presenting the data from the NORSE clinical trial. The NORSE trial compares two groups of patients. It was randomized in patients who had cisplatin ineligible metastatic urothelial carcinoma, and patients were randomized to either Erdafitinib alone or Erdafitinib plus Cetrelimab, an immune checkpoint inhibitor that targets PD-1 expression on tumor cells. This was a randomized but non-comparative cohort trial, similar to what has been used in other clinical trials, including those with enfortumab vedotin and pembrolizumab. When we enrolled patients on this trial, we saw a very promising objective response rate in both cohorts. In the Erdafitinib only arm, the objective response rate was around 44%. And in the combination arm of Erdafitinib plus Cetrelimab, we saw a response rate around 55%, with an improved number of complete responses in those patients who received the combination as well. So gaining a sense that we're seeing deeper and more durable responses in the combination, combining Erdafitinib with a checkpoint inhibitor. This translated to an improvement in progression-free survival as well. With the Erdafitinib only arm, we saw a median progression-free survival of around 5.5 months. With the combination arm, we saw a progression-free survival of around 11 months. And overall, this translated to an overall survival benefit of around 16 months for Erdafitinib only and around 20.8 months with a combination of Erdafitinib plus Cetrelimab. So when we look at these results in aggregate, the Erdafitinib only arm is very similar to the objective outcomes that were observed in the phase 2 clinical trials, which reported a 40% response rate and median overall survival of around 1 year in previously treated patients. The combination arm looks very promising as well, with an improvement in objective response rate, translating to a progression-free survival and overall survival that I feel is worth further investigation.